Well, the CDC says doubling up on your masks could protect you and the people around you even more from COVID-19. Tonight, a local health expert walks Fox 4's Rachel Lloyd step by step through best practices for wearing your mask.
The first step of mask protection is knowing what kind of mask you're working with.
Some of the earlier surgical masks, the paper style masks, were also only one layer.
Robert Hawks, the director of the Physician Assistant Program at Florida Gulf Coast University, says those one-layer surgical masks still let a lot of particles in.
If you can pull it apart, kind of like I'm pulling this apart, then it's a double-layered mask.
He says that works just as good as wearing two. The Centers for Disease Control and Prevention released data this week showing wearing a cloth mask over a surgical mask, even when those around you aren't wearing anything, reduces the spread of your droplets by 82%. That protection jumps to 92% when everybody does it. This is what it's like. Hawks says the next step is looking at the fit of the mask.
Having like a wire clip around your nose so that you can get a good seal, and also the same thing around people's cheeks and kind of around their chin.
That prevents these gaps where air droplets go in and out of your mask like nothing's there at all.
And then you just kind of tighten it up along the sides.
He walked me through making my mask work best for me. And then do the second one. And then bring it down. Cool. And it also has the wire clipping. I can adjust that.
And the mask should probably feel pretty snug right now.
Yeah, nothing's getting in or out of this bad boy. And if you don't have a mask like the one I have, the CDC says you can improvise with your surgical or cloth mask by still tightening it with what they call the knotting and tucking procedure. But they say that only drops the risk of spreading droplets by 63%. Or you can do what Hawks does.
And then sometimes people on these will actually double them over. They'll kind of make like a loop and then put those around their ears to make them a little extra tight.
Hawks says with the tighter mask comes a little more breathing restrictions, so avoid wearing them for an extended period of time unless you absolutely have to. Rachel Lloyd, Fox 4.